We're joined from the campus of the University of Mississippi Medical Center by my friend, Dr. Lisa Bryant, Assistant Professor of Physical Therapy there at UMC, pediatric physical therapist, owner of Reach Therapeutic Solutions. Just a resume I will put up against anyone. This is our entrepreneurship class here at Velma Jackson. I've got a room full here with me, and we're recording this for all of our friends in Madison County Schools, Madison Central, Ridgeland High School, Germantown High School, Rosa Scott, the Academic Options Center, and my good friend Mary Slaughter over at the Madison Career and Technical Center and our YouTube channel. So thank you for taking some time for us today.
For sure, my pleasure. I love doing this talk with you whenever I can get my schedule clear enough to do it. So I'm glad to
Yeah,
be here.
you were one of our first guests on this platform, and here we are 5 years later, still going strong. So glad to have you again. And a lot has changed since then, because we just give us a little background. You are originally from Mississippi, went to Jackson State, and then graduated from UMC to become a physical therapist. And I've had a lot of kids tell me they were interested in physical therapy, but it's kind of not just a straightforward route. So talk about the route that it takes to become a physical therapist in the state of Mississippi.
For sure. So going back to a little bit of background by myself, I'm born, raised, and educated from kindergarten through my doctorate in Jackson, Mississippi, a proud JPS graduate. Graduated from the Murrah High School. I understand it's you all's rival, but it's okay. I went on from Murrah to go to Jackson State, ran track there for all 4 years, was there on a full academic scholarship. And let's see, from there, I graduated from the Jackson State in 2009 and went to UMC and graduated from there in 2012. And from there, went on to work in acute care for about 9.5 years. Went PRN, went into pediatrics, opened my own pediatric practice. I always said if I wasn't a PT, I'd be a teacher. So when I went to PT school, I was like, light bulb, I could teach PT. And so when that door opened in 22, I ran through it. And now that's how I ended up here as an assistant professor in physical therapy. And so as far as the path to physical therapy, so you'd have to have a bachelor's before you can apply for this doctoral program. And so we have some changes in our curriculum coming down the pipeline. So you'll have to meet all of your prerequisites, I'll put it that way, before applying for a physical therapy school here at UMC. And so one of the things that we suggest is to maintain a high GPA. We have upwards of 100 applicants every year, and we only accept around 50 students. So you have to be a strong
Oh.
candidate in order to get into our program. But it's very feasible. I say if I can do it, you can do it. I was kind of a non-traditional student. But anyway, I won't go talk too much about myself. But with that, have a strong GPA, study for your GRE. I know some people say, oh, just take it. It
Oh
doesn't
man.
matter what you make. We do look at it. And so there are some tips and tricks and a lot of quick types of things that you can look up, even on YouTube, to help you with that. Maintain that high GPA, gain a lot of experience in volunteerism, become leaders in the societies that you join, have a lot of community involvement. We want to see that you're a well-rounded person who can communicate well, and that you maintain those good grades while doing all those things. So that's just kind of in a nutshell what that path looks like.
Yeah, and it is 3 years after you get that bachelor's. Now, real quick, we had a recent alum of Velma Jackson who is finishing up. Actually, I think he just finished up at UT Southwestern in Memphis, and he went also a Jackson State alum. But what he did, I thought was really cool because he got his degree from Jackson State. Then he
Mm-hmm.
spent 1 year working as a PT tech at Capital Ortho
Mm-hmm.
to learn about the exercises he would be performing, what he would be the way he would work with or I guess with patients to learn how the business works. And I just think that's so crucial in any type of business because before he wants to own his own practice, and
Oh, sure.
before he opens the door. Before he even stepped foot in PT school, he learned all about the way the PT business works. So he was making some money, but
Right.
he was learning along the line. So how important do you think is that for someone, if they want to take that year off to kind of learn the business and learn the craft before they get into the actual program, or if they want to own their own practice to work in a PT area and say, here's how all this stuff works.
For sure. I'll go back to that gap year. I'd say it might not even be necessary to do that. I actually worked as a tech the year that I was applying for physical therapy school. I worked at a hospital, so I was able to work on weekends while going to school at Jackson State and get that experience. Now, on the professor side of it, one of the questions that I ask in our interviews for new students is, what other careers have you considered, and how did you land back on applying to PT school? That lets me know that you thought through your career path, that you have considered other things, and this isn't just checking the box, right? We want those that really want to be a PT in our program for sure, right? And so, again, yes, you can go ahead and work as a tech if you find the right setup. And I'm letting you all know that that's usually through acute care because they have weekends available, so that you can get that experience while in school. Only, I don't want to shy away from or say that it's a negative to take a year off. That doesn't count against you if you're applying, but I'm just saying it may not be necessary.
Yeah.
Um, what we're doing as far as even recruiting now is doing this, talking to high school students. I'm going to talk to a fourth grade class tomorrow. We want PT on your mind earlier so that you're considering it earlier, so that you're having a very pointed path by the time you are even applying to undergrad, right? You don't want to waste a year of courses that you don't have to take. You don't want to waste time on, well, now I have to go pay for another semester of school because I didn't get all my prereqs because so there are non-traditional paths, but the better education that I can help share earlier on, even in high school, the better. So another suggestion that I would make for high school students now is make the good grades now. I'm pointing to all the kids that I cannot see. Everybody who is seeing this, your high school GPA is important, because if you can get a
Absolutely.
full ride to undergrad so that you don't have to pay for grad school, that'd be great. That's what I did. I got a full academic scholarship. Even though I was offered a full track scholarship, I didn't want my undergrad budget to be dependent on the track budget, right? So there are people that came in with me who got a full ride, but once the track budget, got cut, then so did their scholarships, and that's as a junior or senior. And as one of 8 children, my parents couldn't pay for I told them, y'all not paying for my college. And so I was able to pay for um, my 4 year academic path, I guess you could say, through my high school grades. So what you're
Yeah.
doing right now matters, regardless of your grad school career
Yeah,
path.
and they all get an ACT for free twice
Oh yeah,
during school. Where was that when we needed it? So,
exactly.
and I know at Jackson State the full scholarships start at a 30, but even a 20 at an ACT is going to get you in, at least your foot in the door at every public university in Mississippi, and
Yeah,
then you look at qualifying for grants. Now, we'd be remiss if we didn't, because our health science students are going to see this, and we have a variety of goals that our young people have. Some of them, may say, "Look, I want to go to college. I want to do those 3 years, be a PT, because Lord, we obviously need more PTs. We need more female PTs. We need more bilingual PTs all day long." However, you can get into the PT field without necessarily going to college. We need more good PT assistants.
okay.
Hines and Holmes have unbelievable PT assistant programs. I have friends that
Mhm.
have done both. They're working hands on with patients every day, making a
Right,
good living, and that is a great area to get into. So talk about the need for PT assistants and occupational assistants as well in some of these
right.
clinics.
There are multiple paths, just like you said, Greg, or Mr. Piggott, how do they refer to you? So if you just want to be in the field and see what the field is like, again, no schooling is required to be a PT tech. For PTA schools, of course, that's its own path that does require prerequisites, but from my understanding as well, that it's a 2 year program after you get those prereqs. So you may not have, like you said, you don't have to go to college thereafter. Some people say, well, I'll go to PTA school first and then do a bridge to PT if, I like it and want to further go into my learning. Now, that is the only path that I say it's a little bit stricter. There are very
Yeah.
few PTA to PT bridge programs. So another reason why I try to go in and talk to students as early as possible to help direct that path. I don't want to, some people see that it's a doctorate program and get gun shy immediately, right? And get shy about it. And so that's something that I don't want to happen. So I'm like, hey, look at me. I'm a product of JPS. I did it. You can do it. And so we also have mentorship programs that we can help students walk through. We have a pre-academic counselor here at UMC where even if you are in the business of trying to decide your path, you can call our pre-academic counselor and she can even talk to you about that.
Yeah, and obviously, I think it needs to be said. Any type of medical field, but especially PT and OT, you're going to have to touch people. You're going to
Right.
have to see things. You're going to have to deal with people crying. You're going to have to deal with people that are
Right.
upset. You're going to have to deal with people that maybe have lost a limb and they have, and that and the depression is very high. You got to help them help strengthen their mind. You have to smell things. You have to see blood. So
For sure.
I have a lot of kids that want to say they want to go into the health science area, but they don't think about you got to actually deal with human bodies.
Hmm. And I have dealt with every case scenario you just mentioned. I worked in acute care and I worked in the ICU right before I went into pediatrics. And so I think there are some core aspects of, I don't want to just say your personality, but of your character that would be necessary to be a good PT. And one is empathy. Empathy can help you get through the I hate blood, the someone cursing you out. I've had someone who's thrown racial slurs at me, right? But I still have to treat you as a patient, regardless of your failure to see me as a person. Okay. And so with that, your empathy can lead the decisions that you make and how you approach being a therapist, regardless of who your patients are. And I always follow the golden rule: do unto others as you would have them do unto you. When I'm dealing with my elderly patients at the hospital, I think, what if that was my grandparent, right? And treat them as such. When I'm dealing with children who may be having some behavioral issues or crying, crying is their way of communicating that they have a need that needs to be met. So I have to be aware of that. And I'll even say, even in our pediatric elective course, we expose our students to CARES training, which tells you how to communicate with kids with special needs, in particular if they have behavioral issues. So nothing is a red flag enough for me to say they're hands off. I can't touch them, right? And I say that there may be a few asterisk situations where I may need to have someone else in it, but you can name it. I've probably experienced it as a therapist, but I have to decide what type of therapist I want to be, regardless of my patients. At the end of the day, I want you to have good outcomes. So if I have to
Yeah.
overlook your racism or whatever it has to be in order to be a good therapist, then that's what I have to do.
Yeah, and that was a great segue to what I want to talk about next because, and I know they get sick of me talking about this, but I can't talk about it enough. I'm really big on learning communication skills, on learning sales
Sure,
skills, learning marketing
sure,
skills. And look, in your field or in any other type of business, if you're a computer person, you got to talk to a person like they don't know have any idea what you're talking about.
for
If you're an
sure.
insurance person, you got to talk to them like they don't have any idea what you're talking about.
Hmm.
If you're a therapist, you have to explain to someone, here's what we're going to try to fix. Here's how we're going to do it, and here's how you're going to get better. You can't be scared to speak to people. People's livelihood is on the line a lot of times.
Right,
People's way of life is on the line. So, how important is it to learn these communication skills on top of all of the on top of all the medical skills?
sure.
Because in any type of business, if you can communicate, you can be successful.
Right. I'll talk about that from two pieces: as a business owner and just simply as a therapist. Being a female therapist, an African American female therapist, my demographic is one of the least believed in any aspect. And I can reference a study that talks
Yeah,
about that.
absolutely.
So often I tell my students, I have to be the nerd first. So I intentionally introduce myself as Dr. Bryant. I have to intentionally come into the room, telling them what I know about their disease process, telling them my plan of care, why I'm doing the intervention that I'm doing, because in the field of physical therapy, patient buy-in is paramount. I'm only going to
Absolutely.
see you for 1 hour, maybe up to 3 hours a week. You're in charge of your care and your rehab all of that other time, right? So it requires a home exercise program. It requires you changing your lifestyle in order to improve your outcomes. I can't do that by myself. So I have to be able to communicate what my plan is, why I'm doing what I'm doing, and how efficient that plan is, right? And so with that, I have to use evidence. I have to go on the research and make my plan based on what has been found to work already, right? So that's one pocket. The other pocket is, as a business owner, I can't hide behind the big business name. When I was practicing with my private practice, going into a child's home, I'm coming in as Dr. Lisa Bryant under Reach Therapeutic Solutions. I can't hide under a big name. So how I presented myself was a representation of my company, right? I had to be my own brand and I had to communicate in a way that would protect my brand. Sometimes you can go on these websites, I think it's Jackson Foodies, and they'll drag these businesses, right? But what you see is a lot of small business owners still care about how their business is being presented. So they come with that care and with that one-on-oneness about how they present themselves. So yes, just do good work and communicate that effectively. So I hope I communicated that well.
Yeah. Now, one thing I always thought was interesting because, like I said, when you were operating full time Reach Therapeutic Solutions, you were a one woman show.
Hmm.
And I've had several people on the same platform, including Dr. Angela Shannon, the owner of Happy Tummy's GI Clinic,
Oh yeah,
tell me, how important it is to learn how to run a business because you
exactly.
can learn everything about the medical field. You can learn everything about whatever field you want to do. We got a young man here that wants to get into barbecue. We got another one that wants to run a clothing line. You can have the best skills in the world, but
Hmm.
nobody, and I thought it was so funny. Dr. Shannon said, I knew everything there was to know about how to save somebody's life when it came to any intestinal issues, but I knew nothing about how to run a business. So,
Hmm.
what type of learning curve do you have? Because I have lost count of the amount of kids that said, I want to be an entrepreneur because I want to be my own boss. Well, that's
Hmm.
great. It's not just flip on the lights and start making money.
That's right. And I'll tell you my horror stories. I was the same way. Knew a lot about physical therapy, had a lot of passion behind what I was doing, but did
Yeah.
not know insurance, did not know payment very well. Of course, I was exposed to it in PT school, but it was just like, oh, I don't need that information because at the time I didn't, have it in mind that I would want to start a practice. It wasn't until 7 years later while I was looking for flexibility that I was like, hey, I'll start my own practice. And so long story short, I got this opportunity to work at a place and bring my practice into it. But because I didn't know billing, I ended up doing thousands of dollars of work for free because I did not know how to file my own claims and get reimbursed. Right. So you can have a great idea, but you need a mentor. Okay. And so I quickly reached out to several therapists who were already doing what I wanted to do. So you want to find a mentor who's doing what you want to do and who's doing it well, not somebody who's necessarily burnt out, scratch and working 80-hour weeks. I want to see somebody who is living the model that I want to live. And you want to consider your home life, work life balance when you are looking for that, not just grind, 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 because that's not healthy, right? So I wanted a full work life balance. I have 3 children who are all in multiple sports. I can't only be working and not taking care of my family well. My
Yeah.
family is my first ministry. So my business is built around that. Okay. So I say find a mentor. That's my number one piece of advice that's already doing what you're doing. You all have the benefit of growing up in the AI age where you can ask chat, you can develop this really good prompt that spells out everything what you want your work model to do and tell it to and ask it, give me some ideas. So use it as a tool to think through some things and brainstorming. And it can actually, there are several AI models that can help you with kind of directing that path, of course.
And something I thought you did that was smart is because so many businesses they're so desperate to make money they'll just try to sell anything and everything.
Oh yeah.
But you focus solely on pediatric physical therapy.
Hmm.
It's not that you weren't qualified to do the geriatrics or the injuries or any the injuries to adults or workplace injuries. You focused on one market and got really good at that.
Hmm.
So as people are deciding what business to get into, why is it important to narrow down your target market and be successful at that one area?
That's a great question. And what is often suggested when looking to start a business is to survey the community that you want to service, see what need that community has, and your business needs to be an answer to that need. So, you may want to make t-shirts, but if there's not a need for that in your market, your business may not be successful. It can be an add-on to something that you want to do, but specifically in healthcare, you want to have meet a need. And it just so happened I started my practice in 2019. I did not know the shutdown was about to happen. Did not know it. But I started a mobile PT practice. So I had a caseload who wanted me, they have sick children. They wanted me to come into their homes instead of getting their babies out in the world, exposed to sickness and all the things. So I had a very niche community that needed a need met, and I was able to plug in and meet that exact need, right? So you want to create something unique. And let me backtrack. That's not to discourage anyone from making t-shirts. You may have a phrase or something that goes on a t-shirt that is very beneficial for the community. I can think of the suicide prevention shirts that someone made not long ago that had the suicide prevention number on the back, and everybody loved that shirt, right? Yes, it's a t-shirt, but there was a unique need. So think of a way that you can make your business, your passion, your idea unique and plug in and meet that niche need.
Now, and I got some of their questions I want to get to, but I think something
Okay.
that's kind of interesting that we need to talk about because before we started recording, we had some minor technical issues. So
Okay.
that's not, obviously you're a very intelligent person, way more intelligent than me, but that just goes to show you how much technology has changed.
For
Because
sure.
even when our parents were coming through, even when you started becoming a medical professional, technology is becoming more and more a part of the medical industry. And I think you can agree with this. There's a lot of money to be made in medical technology. If you
For sure.
look at the IT people, all the, Epic software, I don't even want to know how much money they're making right now. I know that's the software that is used at UMC, and it was a multi-million dollar rollout. So, what are some of these? We have kids that are interested in health science. Maybe they're not interested on the clinical side, they're interested on the technology side. But that
Hmm.
is a area that is not going away and is going to be more and more advanced. So, what
For
are some
sure.
opportunities there as far as business ideas?
Okay, I'm glad you said that there are people that I know that have left the healthcare field to go be an Epic representative. And so they knew medical technology, but they again brought that information to go be a part of tech. And that works hand in hand. That's a good thing because as a therapist, if I'm using a documentation system that isn't even built similar to the structure of the evaluation that I have to perform, it's difficult for me to navigate that system. So what they need is somebody who's knowledgeable of PT to go in to be that person that, fixes that technical system, that IT system. There are AI documentation systems that are coming about that will help preserve, HIPAA, which is that act that protects patient information, right? So they're using AI models to help create those platforms to ease documentation, create ease of use for therapists. And so one of those types of things is there's software that will allow you to record your conversation with your patient, and then it'll turn around and spit out your patient note, your PT note, right? And so those things are coming about due to the advances in AI. Jackson State, I believe, has a partnership with Maine. Don't ask me what the acronym means. MAIN. I think it's like the Mississippi AI Network or something like that. That may be it. But they have a partnership that I became aware of over the summer because my son got into a quick tech program. So there are opportunities everywhere. I'm not as well versed in those, but just keep your eyes and ears out for those. Look, like I know Jackson State in particular has some summer programs for that. And so just, yeah, usually there is somebody in the community that has these early education programs.
But that also shows why we need diversity in the field. We have another guest of this class that wrote a whole book about unconscious bias in AI programming in the medical field.
Wow.
And and it's not that people are racist, it's not that they're
Mm-hmm.
evil, but if people don't know and don't have that background, things are going to get missed. So
Yeah.
there's a huge need for diversity, not only in medicine, but in AI as well. And that's a whole nother rabbit hole we could
Yeah.
go down. But I do have some questions here.
Okay.
And this first one is really good. I like this one. This is Shanaria Lewis. She's in 10th grade, has a great business concept for a home health business. And she's kind of a two-part question, but I like this first part. She asked, when you have a patient as a therapist, are you trying to make them back to being productive or to make them more comfortable?
That is a great question. My husband is also a physical therapist who does home health physical therapy. And one of the things that we have to do at the evaluation, the first time we're seeing our patient, is something called PLOF, the prior level of function. And so we say, hey, this is what you were able to do before you got sick, before you had surgery. This is where we're trying to get you back to being able to do it. So if you were a high performing athlete, that's what we want to get you back to doing. If you were wheelchair bound, but maybe couldn't access your home very well, you couldn't maneuver your wheelchair very well. We want to get you as independent as possible. That's always the goal. Okay. Sometimes that is comfort. Now the patient is in charge of what they want their after therapy life to look like, right? So we have to communicate with the patients. We're not coming in a dominating role saying this is what you need. often it's hard when we see the potential that a patient has that the patient isn't aware of. And so it's hard sometimes trying to convince them of where we can help them achieve the highest level of function that they can achieve. But at the end of the day, they have the autonomy to make decisions for themselves. So we come in and say, hey, as a therapist, I've been seeing, people just like you for years, and I think you can XYZ. And so we inform them of their potential, but they have the autonomy to make those choices for themselves.
Love it. And now she asked this, and I think this is a great question as well. She asked, "Do you remember the time where you all of a sudden realized all my hard work paid off?"
Oh, yes. I remember several patients crying in their rooms with them. I had one patient, he had cancer, and one week I would see him several times a week in the hospital. One week he would be so sick that he couldn't walk to the door. The next week we could walk down the hall. And so this kind of yo-yoed back and forth depending on how sick he was at the time. And I remember a few months later, after he discharged from the hospital, I saw his daughter at a restaurant, and he was so sick that I was afraid to ask her how he was doing because I didn't know if she would say he had passed away. That's how sick he was. And she told me he had a PET scan and it was all clear. And that, like, I'm still talking about it years later, right? Those types of wins are huge. In acute care, you can have some quick wins where somebody who came in the hospital and couldn't walk, and you got them to be able to walk down the hall by the end of the week. Like, that's a big deal. I've had kids who couldn't learn how to jump, right? And then you teach them how to jump, and we're having a big party. A child took his first steps in my clinic after not, walking for months. So those types of things leave a lasting impression on you. It reminds you of why you do what you do. It has that good feeling of that reminds you to come back to what you're doing because you're pretty good at it. So I love having those moments, and I have plenty of them.
I like it. This is Elijah Dawson. He's in 10th grade, and he asked, "What would be the best college major to get into a PT program?"
That's a good question, Elijah. As far as UMC's prereqs, we don't have a certain major that you have to have as long as you have your prerequisite courses. Now, a lot of those courses are captured in biology majors, kinesiology majors, some chemistry majors. What you want to do is look at the prereqs for the programs that you want to apply to, make sure you're taking those courses in a timely manner, and really you can pick. We've had math majors, we've had psychology majors. Speaking back to Dr. Angel's point, you could be a business major, get some of that knowledge in your undergrad education, as well as your prereqs. And then especially if you're looking for entrepreneurship, that those classes were already paid for within the 4 years of your bachelor's degree. So that's something that I would, I meant to circle back to that. That's something that I would suggest. Go ahead and take your finance and business classes. And then don't let the classes that you take be solely based on what you like to take. You're going to have to take some classes that you don't like and find ways that you will just, for instance, finance, some people say, I don't like numbers. You like making money. Make it make sense to you so that you can develop a desire to like it.
Big time. I got two more.
Mhm.
This is Tredarius Quinn. He's in 10th grade, member of our band here. And he asked, "What was harder, being a therapist or being a business owner?"
Oh, being a business owner. And it's because I wasn't diagnosed with ADHD until this year. And finding out more about myself with ADHD really explained the things that I struggled with as a business
Yeah.
owner. I'm not driven by money, so that's why I ended up treating uh, plenty of kids and lost thousands of dollars. Didn't tell my husband that, so don't y'all tell him. But it was the pressure. There are some things about my ADHD that made it difficult to
Yeah.
lock in, get those uninteresting things done, even though they were really important. That didn't make it, it didn't translate in my mind. So learning about myself helps me, or would have helped me better as a business owner. Like I have the personality, the compassion, the empathy to be a really good therapist, but those daily tasks that felt very uninteresting and felt like pulling teeth because I have executive function disorder, that was hard. So it was definitely more difficult to be a business owner, but that's particular to me. I wouldn't say it would have to be difficult for you, Mr. Quinn. Just learn about yourself and see where your weaknesses are and sharpen those, and that'll make you better as a business owner.
Well, he's got a great idea for a clothing line. He's close to launching, so he knows how to, he knows what he's doing. I think he's gonna do a great job.
Excited. So I want
All
to. I
right,
want to copy. Look, my
Yeah.
maiden name is Quinn. We might be related.
Oh, nice. All right, I got one more. This is Jameer Mayfield. He's in 11th grade, also in the band,
Okay.
and has a great idea for some barbecue.
Yeah.
And he asked, "What is the biggest obstacle you've had to overcome as a therapist and a business owner?"
Oh, the biggest obstacle. I've had many. As a business owner, it was finding out what I didn't know. That was a scary part. You don't know what you don't know, right? And where you think you know everything you need, it wasn't until my claims got denied that I found out that I didn't file something the right way. So being able to persevere even in the face of your failures jumping back at you. Don't give up just because you're finding out that something is difficult or that you didn't know what you needed to know. There's always room to learn. Be gentle with yourself, give yourself grace to mess up, and just be dedicated to learning, right? If you are really passionate about what you want to do, just like I said, pull yourself up from your bootstraps and get it done. Just lock in and get it done.
All right, well, we're almost out of time, and we thank you so much for joining us. But a couple things before we go. First of all, Dr. Lisa B, the PT on Instagram, really
Yeah.
cool stuff. Show some of the stuff you're doing. That's Dr. Lisa B, the PT underscore on Instagram. Really
Mhm.
cool follow. Really show some of the things y'all are doing over there, and some of the things that and just basic physical therapy stuff that you could do at home, that you can learn from. And then also, I think it's important to mention physical therapy is something our friend Alan Loving over at UMC, the volunteer services coordinator, always trying to get young people involved to come over there and shadow the people in the physical therapy department. They can stop
Mhm.
by and talk to you and learn more if this is something they want to get into, learn the ins and outs of the business. They can sign up there. I'm sure if anybody wants to come by and visit, you'd love to talk to them, especially our young ladies, because this is a field that needs more diversity.
For
If you're
sure.
bilingual, if you can sign,
Mhm.
any of that is so needed in this field. So that, as we close up here, why should these kids really consider, this is an area of entrepreneurship that can be tapped into. This is a need that's always going to be here. So as these kids are matriculating through high school, deciding what they want to do, why is this such a great area to maybe look at something you want to start a business in?
That's a great question. So I'm actually in school at Ole Miss getting my doctorate in education in EDD program, and my dissertation or problem of practice is on meeting the needs of or providing PT access in urban and rural communities. So yes, we are producing therapists every year to stay here and work in Mississippi, but we often go work in areas that are already populated, right? While urban, certain communities, and rural communities still lack access to PT. So if you come from those areas, sometimes you're already incentivized to return to those areas and work and provide your skill set. You go to PT school and then you go back to the community that you came from. And so whenever we have underrepresented communities and populations, we would like to directly go in and recruit from those communities in order to go in and meet that need. Again, the business model is find a need and be the one specifically to meet that need. So that's something that I'm passionate about, something I'm working on and will be working on for the next 3 years of my doctoral program to meet that need. And so as research is being done to reveal the needs across PT in Mississippi, then I can make everyone more aware of what those needs are and where you can plug in. For instance, I'm a
Absolutely.
school-based therapist in Hines County, and I as I do more research to look at the need of school-based therapy across the state, then we can see where the gaps are. So if you go to Starkville and want to be the, school-based therapist there, you can own a practice where you provide school-based therapy to multiple counties. And I know people who do it. I know someone in Canton who does it. And so we can help make those connections as well.
Awesome. Well, I know you got to get back to work, and we thank you so much for fitting us in your schedule. And I know I can speak for my friend Mary Slaughter. They would love to have you come speak to their health science group at
Absolutely. I
the
would
at
love to.
MCTC. And I'll pass along information to her. But again, it's always such a pleasure to have you, my friend, Dr. Lisa Bryant at the University of Mississippi Medical Center. Thank you so much for joining us today.
Thank y'all. Thank y'all for the invitation.
I'll talk to you soon, my friend.
Bye bye.